A 10-year-old male comes in with a supernumerary tooth between teeth 8 and 9, the workup, treatment, and the surgical case today on the open reduction. Welcome to the Open Reduction, your channel, everything oral and maxillofacial surgery. I'm Dr. Tom Bolton, and today we're going to be talking about something I see in the office regularly, a supernumerary tooth between teeth 8 and 9, otherwise known as a Mesiodens. This patient is a 10-year-old male who was sent over by his orthodontist to evaluate a supernumerary tooth between teeth 8 and 9. Fortunately, his central incisors erupted correctly. However, this Mesiodens is interfering with the orthodontic plan for this patient, and so it's indicated for removal. This area has been asymptomatic, and the patient has no idea that he has an extra tooth. Supernumerary teeth are extra teeth in comparison to normal dentition. Mesiodens is a supernumerary tooth present in the midline between the two central incisors. Mesiodens aren't super common. Different studies show a prevalence anywhere from 0.2 to 2% of the general population, but we definitely will see them, and it's important to know how to treat them and when to treat them. Mesiodens can cause several potential problems, including delayed eruption of the central incisors, impaction of the permanent incisors, crowding, abnormal root formation, altering the eruption of permanent incisors, a diastema, cysts, infections, root resorption, a lot of bad things that can go along with Mesiodens. The cone beam CT is important because I want to determine if this Mesiodens is oriented more towards the labial portion of the alveolar bone or towards the palate. On the cone beam CT, we can see that the Mesiodens is located palatal to the root structure of teeth 8 and 9, so I'll be approaching this with a palatal flap. Mesiodens are typically asymptomatic and are noted on radiographic exam. Patients sometimes have no idea that there is a Mesiodens present. Other times there are clues such as delayed eruption of the central incisors or ectopic eruption. If Mesiodens interfere with the appropriate eruption of teeth 8 and 9, then I remove them earlier in life. However, in this case, teeth 8 and 9 erupted appropriately, so we're really at an ideal time to remove them right now. The root structures of teeth 8 and 9 are fully formed, which means that they are solid in the alveolar bone. Mesiodens removal is a great in-office procedure. I started this patient on nitrous oxide, and after local anesthesia, I'm going to gently elevate a palatal flap. Here's my incision, which is an intersulcular incision. And then I'm going to take my periosteal elevator and start to retract the tissue. I want to be in a subperiosteal plane to minimize damage to the palatal mucosa. As I'm elevating this flap, I'm starting to see the bone come into view. Access is really important with this. I don't want to shortchange myself by making too small of an incision, but I don't want to go too big because it's going to cause more post-op discomfort. Now that I've laid the flap, I'm looking at alveolar bone, and I don't really see the Mesiodens anywhere. So I'm going to get out the handpiece and start to gently feather off some bone in order to locate it. This is again where the cone beam CT comes so in handy because I have a general idea of where this tooth is, and it takes a lot of the guesswork out of the equation. Now that I'm seeing it start to come into view, I can start to gently tease some of the bone off with the periosteal elevator and with the handpiece. My goal is to get around the palatal aspect of this crown and then elevate the tooth out gently from there. I need to get around this crown, but I want to stay as superficial as possible to minimize the potential damage to the root structure of teeth 8 and 9. Here's the tooth coming clearly into view, so now I'm going to start to gently tease off the bone around it. Now that I've created a big enough window, I'm going to use my periosteal elevator to gently manipulate the tooth and extract it this way. Now that the supernumerary tooth is out, I'm going to use the burr to smooth off the edges and a bone file as well. And then once I'm happy, I'm going to irrigate it very thoroughly. Finally, I'm going to close this with interproximal sutures. I love doing Mesiodens. Thanks for checking out today's video. Please click that like button and subscribe to the channel. All kinds of content, oral and maxillofacial surgery. I'm Dr. Tom Bolton. Catch you next time on the Open Your Doc.